Involved in an auto accident, you and your family were lucky to escape without injury. But did you really? Many people experience pain or complications months later when the accident is just a faded memory. Chiropractic care can help and is covered by your auto insurance policy if you are involved in an accident. Don't wait. Make the call. Shillington Chiropractic Associates, 610-775-X-Ray.
Chiropractic Better Health Naturally on BCTV is supported by Shillington Chiropractic Associates.
Good evening and welcome to our continuing program on health. We call it Better Health Naturally. This is Dr. Johns. I'm going to be your host for the next half hour. Tonight I'd like to talk about a topic that we've seen for over a quarter of a century in the office. It's back surgery. We see a lot of people, and unfortunately in my profession, we never really see anybody with good back surgery. They don't come into a local doctor of chiropractic if they're not in pain. They come into us because they are in pain. And I want to go over a couple of basic things because the healthcare profession has been changing, and now we know with Obamacare that soon in 2016, everybody is going to be forced into Obamacare if it doesn't change. Even if you're in a healthcare plan for a school or a Fortune 500 company or a large utility, whatever the case might be, by 2018 for sure, if everything stays the same way, everybody is going to have to be on Obamacare. Well, the fact that it's not working doesn't really matter too much right now. This is the federal government. The point is, many people come to us and now they're even requiring doctors of chiropractic to sign off on somebody before they get back surgery. And the reason for this is simple. Many times, if we use the same philosophy we use on our cars, let's say you get up in the morning and you're ready to go to work and your car doesn't start. Very few people say, well, take the hood off of the car, take the engine out, rebuild the engine, and spend all this kind of money. First, logic dictates that you do the least invasive or least expensive thing first. The same logic should apply to our bodies. But our bodies are designed so well and maintain themselves so well that we really don't get to that point until we're in crushing, crippling type of pain where we can't walk, we can't sit, we can't sleep, whatever the case might be. Then we go out and seek attention. Many times before you get this kind of pain, your body gives you notices year after year with different episodic little things that happen, like you go out and cut the grass, you rake the yard, you do more than you normally do, and your back bothers you a little bit. And every year you do the same thing, it bothers you more and more. That's one category of back pain that we see. The other category of back pain we see is also those people that are involved in traumatic accidents and or, let's say, congenital abnormalities in the spine. And we'll get into those here in just a few minutes. This is a live program. You can call us here at the studio at 610-378-0426, and we'll be happy to talk to you and answer any questions we can. But the thing we want to stress here is the mechanism that you go through before you get a back operation. The joke is, if you go to Midas, you get a muffler. If you go to a surgeon, you get an operation. And many times, the local surgeons now, because the environment is changing, they usually don't do surgery right away. They'll send you to physical therapy, whatever the case might be. But let's orientate a little bit and go over some of the anatomy. Back surgery, lower back surgery is the most common. And we brought along some diagrams so that we can show you what it looks like in 2 dimensions on the camera here, and then we'll go to 3 dimensions with a couple of little models. Thank you. Now, the first model you see is the lumbar spine. And if you count up from the bottom, at the bottom of the page is the 5th lumbar vertebrae. On the bottom it says disc degenerate or degeneration with osteophytic formation. Then there's L4 above it. Then there's L3. There you see what's called a herniated disc, and you go up a little bit forward. There's 5 vertebrae in your lower back. Now, if you start at the top of that diagram, you see what looks like a normal disc. Now, a normal disc basically looks like a double stuffed Oreo cookie. As long as the vertebrae above it and the vertebrae below it are level, then the disc doesn't get pushed out to one side. But if you take an Oreo cookie, for example, and you squeeze it on one side, all the white stuff goes the other way. It's an oversimplification, but this is basically what the disc looks like. Now, the other thing, if we go down one level on this diagram, you see the words degenerative disc. And there's 2 little black lines inside the disc, if you can see that on your television screen. This is what we often see. The height of the disc is what we see when we take x-rays. And by the way, we often encourage and recommend, and in our office that's what we do. We take x-rays to see what you look like, and one of the things we see on the x-ray is the space between the bones. The black space on an x-ray is the disc space. Now, we can't visually see it, but we see its shadow. And if you go down one more level on this diagram, you see what's called a bulging disc. And to the left of the diagram, you see a little, looks like a pearl in the hole where the nerve root comes out. And this is a classic type of disc herniation or bulge. And this puts pressure on the nerve root that comes out of the hole where the disc bulge is on this diagram. And if you go down a little bit further, you see other diagrams that are in different stages of degeneration. Now, the next diagram we want to go to is the number of events per 10 million people in the United States. This is the number of deaths from spinal surgery is 200,000. Now, unfortunately, this is one of the complications that you have with any major surgery. Just like if you have a C-section, it's 7 times more dangerous than having a normal natural birth. And if we follow this diagram further down, we go to death from cervical or neck surgery, 68,966 out of 10 million people. Death from a hospital mistake, this is a lovely one, for 60,000. Death from a laminectomy, I'll show you what the laminectomy looks like on these models when we get done showing you the diagrams. That's 50,000. Death from aspirin, Tylenol, Advil, Motrin, prolonged use, 8,333. I have to tell you with this statistic, there are many different people that go, there's about 1,400 people is what I saw last, in the United States that go to the hospital every month because they have pickled their liver because they've overdosed or overdid it on usually Tylenol and Advil. But Aleve and Motrin are in the same category. Now, this is one you often hear of. The next one down is paralysis or stroke from back or neck surgery. 7,148 out of 10 million surgeries performed. Now, this next part of this diagram gives you kind of an orientation to how prevalent these things are. Death from an automobile accident, we have a 1,500 chance out of 10 million dying in a car accident. Stroke from birth control pills is on this diagram. The next one down, 417. Getting struck by lightning, 14. Also in that category, I'd put getting bitten by a shark is less than 14 out of 10 million. Death from an aviation accident, death in a plane. Unfortunately, they just about 2 weeks ago found parts from the plane that was missing for about a year down, I guess it was Asian Airlines. And then stroke from a chiropractic adjustment. This is one I love, 2 out of 10 million. People always say, well, if I get adjusted, it's going to give me a stroke. Well, there you have the statistics. Okay, let's go to the next diagram. Why choose chiropractic for back pain? Here's an interesting one with a little cartoon of a man standing here holding his back. 28% lower cost per treatment. It compares in this particular diagram chiropractic care at $289 to traditional care at $399, or let's just say $400. And then it is 32% fewer or back surgeries. Those who use chiropractic preventive health care have 32% fewer back surgeries. That's what this paper is all about. Of the 1,000 back pain episodes, 4.8 episodes required surgery for those with traditional care. And for those who had access to chiropractic care, the number decreased by 32%. Now, then it goes down to the very last statistic on your screen there. It says satisfaction rate. 95% of the chiropractic patients are satisfied with the care they have received. Now, there's something else I wanted to say in conjunction with this diagram. As doctors of chiropractic, when we see patients, if we try natural, conservative chiropractic care and adjust the spine, and you don't get better, appreciably better after a couple of weeks, either we do more investigative things like we start out with x-rays. If after 2 weeks of treatment you're not any better, you're still the same, we'll do an MRI. After the MRI, if you're still not getting better, then we'll send you off for back surgery ourselves. We've done that a couple of times over our career. But the natural progression of going from I have back pain and I can't stand it to getting an operation isn't working anymore. And these statistics are one of the reasons why. Okay, the next page says startling back surgery statistics. This study reveals that back surgery fails 74% of the time. Let me read you the rest of the story, as Paul Harvey used to say. After 2 years, only 26% of those people who had surgery had actually returned to work. Obviously, this is a study from workers' compensation. That's compared to 67% of the patients who didn't have surgery, even though they had exactly the same diagnosis. And the source of this information is called the Spine, the medical journal considered to be the leading orthopedic journal covering cutting-edge spine research. So these are not even statistics from the chiropractic profession. These are statistics from the orthopedic profession. And now we go on to next to the last one here. It says chiropractic. Think differently about feeling good and staying healthy. In a 7-year study showed that patients whose primary physician was a chiropractor or doctor of chiropractic experienced the following results. Top of the page, 60% less hospital admissions. And incidentally with that, Medicare patients now, when you go to the doc in the box, you have to contribute $1,000 before they even let you in the door. Medicare doesn't pay for the non-traditional if you don't go to the hospital. 59% less days in the hospital. These are the 7-year study patients who were under chiropractic care. 62% less outpatient surgeries, and 85% less pharmaceutical costs. So there you have it. We have one more piece of information we'd like to give you that came across our desk, and this one is on the FDA approving OxyContin for children as young as 11 years old. This is from NBC News. And this particular document talks about OxyContin, and we bring this up because OxyContin is used to reduce the pain. Now, OxyContin is an opioid, and it means it comes from the heroin family of drugs. It's habit forming, if to say the least. Hopefully, with this particular headline, the FDA approves OxyContin for children as young as 11 years old. This is only for children who are deathly ill and probably won't recuperate. But the reason we found it interesting is we see a number of patients that come into us that are on OxyContin, and it's a very, very potent drug, and it's hard to get people off of it. But here's the basic anatomy that we want to go over as well. In this particular instance here, we have vertebrae, and you can see this vertebrae. This is the basic building block of your spine. In between here is the bones, and in between the bone is the disc. And at each level, there is a nerve root that comes off. Now, as long as the bone is healthy, the disc itself looks like a big chunk of Bermuda onion, like you put on a cheeseburger. And in the center is a gelatinous ball bearing. Now, this is a tripod arrangement where your weight is borne with 3 different areas of distribution. Now, as time goes by, this is the classic thing that we look at, that we see on an x-ray. Let me see if I can hold this straight. That way. That's better. This is the space that we look at on an x-ray. We see it from the front and we see it from the side. This is analogous to the tires on your car. Let's say, for example, you hit a bad pothole and you knock the front end out of alignment. Well, this disc space here wears out after 10 or 15 years when you do that. Now, this is unfortunately not usually the stage that we see people come to us in. Usually when people come to us, they're in this stage where the disc is worn down, and on one of these diagrams, the first diagram we used, there was the word osteophyte. These are the little osteophytes that build up around the disc. And when the disc decreases in height, then you put pressure on the nerve root where the nerve comes out. It's like stepping on a garden hose. So if the energy can't come out of the nerve root, you don't get the energy into your arms, your legs, wherever. This is where you get the classic sciatic pain. And then finally we have a fused disc where the whole disc is basically gone. All you can see is a rudimentary disc that's left on the x-ray. This is kind of like taking two little tea candles and you light them and you heat them up and you let them get hot and let the wax drip off of them, blow the candles out, and then you'd stick those two tea candles together, and this is what you come up with, where you have lipping and spurring all the way around. Now, patients often tell us, we've gone through all the different things, we've seen all the different specialists, and they come in to see a doctor of chiropractic, sometimes as a last resort before surgery, many times it's after surgery. And we want to share a little secret with you here tonight, because this is what we see and this is what you have to correct in order for you to be pain-free. And it has to do with the hips and the pelvis. There's two very important joints down here at the bottom of the hips and the pelvis. They're called the sacroiliac joints. They're down here where I'm pointing with my fingers. And this is the foundation for your spine. If your spine or your pelvis is crooked like this, you see the resulting curvature that results in the spine. The body has something in the brain, and we learned this the hard way. It's called the writing mechanism. There's a show on TV now called The Astronaut's Wives, and it reminded me of this. When we first sent the astronauts up in the Mercury spacecraft, we had a little problem because they didn't have a level horizon in front of them like your dashboard. We are what's called land-based animals. We need a level horizon. In fact, the little 3 tubes that you have in each ear that are filled with a little bubble and 30,000 little hairs, there's one set of tubes in the vertical, one set in the horizontal, and one at a 45-degree angle. And when you're out on the ocean, when you constantly move, when you don't have a steady platform or land to stand on, they call them sea legs, then you often get seasick because you overstimulate this mechanism. Well, this is the same mechanism that we have in our brain. Our eyes will do everything they can possibly do, or our brain will do everything possible to make sure that our eyes are level and that our ears are level, because this gives us the orientation we need. Well, these astronauts in the Mercury spacecraft that didn't have a level horizon were regurgitating in their helmets because they were spinning around in space, getting seasick, if you will. But this is the writing mechanism. And oftentimes we will see people who come in after surgery, and in surgery they usually take this little thing here, if you can see this on the television, and the disc sticks out and presses up against the nerve root. That's called a disc herniation. Now, there's 4 different stages of it, and it's kind of like walking out to your car and seeing the tire is low. That's a bulge. And if you see the rim of the tire is halfway down, that's classically what we call a disc herniation. If the tire is still on the rim, but the tire or the rim is all the way down on the ground, that's a disc protrusion, or a disc about ready to protrude. And then if you would drive that car, the tire would come off of the rim. That's a blown disc, just like you would blow the tire. Those are the 4 different stages that we see. Now, what normally happens in surgery, and they've got some great surgeries here, don't get me wrong, but the fundamental concept here is the pelvis has to be level. And only doctors of chiropractic know how to do this. Physical therapists know that that's out. They try and do it, but we're the profession that has been doing this for over 100 years. Chiropractic started in 1895. So the important things are you need an x-ray so that we can look into the spine, and doctors of chiropractic do something that's different than most hospitals do. When we take an x-ray, you're standing up like this model is. When you go into the hospital, you lay down on the table this way and they take an image of your spine. and then they take an image of your spine when you're still laying down and not weight bearing. I often tell people this is kind of like trying to find a tire on your car that has a slow leak, and you go to the mechanic shop and they put it up on a hydraulic lift and then they look at the tires. You have to see a weight-bearing x-ray of the spine so you can see how the body handles your weight. Oftentimes when this particular joint, the pelvis, is misaligned, when it's crooked like this, your weight, 50% of your weight on both legs goes to the leg that's the shortest or the leg that's the lowest. In other words, if your pelvis is crooked like this, the weight of your body, more than 50% of it would be on this leg. And often these patients have knee pain, thank you, and the knee pain is because the pelvis isn't accurately dividing 50% to the left and 50% to the right. But this is the pièce de résistance. This is the ace in the hole. We recently had another patient who came in to see us in the office, and he had back surgery. And incidentally, we had an Amish man who came in and had surgery from one of these spinal institutes down in Philly. Don't get me wrong, it's a good idea, but first you have to do the least invasive thing first, and if that doesn't work, you can always get the surgery. This particular gentleman paid $20,000 cash out of his pocket to have a disc herniation cut off, and he was still in pain. And this is the thing that we see all the time. Patients come into us after they've had the surgery and they say, "Doc, I'm still in pain." And when doctors of chiropractic put the pelvis back in place, here, I'll put it over here, this is the most important thing that has to happen, because when this is in place, then all the discs above it are equally pressurized. And believe it or not, when the pelvis is in place, if you would leave it alone and not go out and cut a core of wood or load wood or chop wood or do something crazy like that, and you give it a chance to recuperate, you put ice on it, don't put hot on a hot lower back, you'll just make it swell up more. That's something that we hear all the time. People go into their medical doctor and they say, "Well, the doctor told me to put heat on it." No, no. This is just like a sprained ankle. If you put heat on it, it swells up more. You have to put ice on it for 20 minutes. You know, you put it in a little cloth or a little towel, and you sit down and you put it on there. But the important thing to remember is go through the normal steps. When you go from the least invasive step, let's say you take Tylenol or Advil or Motrin, and that doesn't touch your back pain, if you go right to the operation when it doesn't work, you can't really go backwards that easy. Or it's harder to fix, and sometimes it's very hard to fix. Now, the other thing I wanted to mention, because I just have a couple of minutes left here, is they often put screws into these bones. And I had said this earlier, I'll show you what the lamina looks like. This part, if you pull this out of the back of the spine, out of the model this way, these are the little projections that stick up on your back that you see. This is also analogous to the dorsal fin on a shark. Well, this Y shape right here is the lamina, and oftentimes they perform a laminectomy. Laminectomy, or lam means this part of the bone, and ectomy means to remove. So they cut off this little Y part of it, and then they believe that it gives your spine more room. Sometimes it works for a little while, but like the statistics we showed you, in over 2 years, 74% of the back surgeries fail. So before you go to that, before you have surgery done, consult with your local doctor of chiropractic, get x-rays. Probably you have x-rays already by that time. If you're a medical doctor, your family doctor hasn't ordered them. The other thing we have to remember is we like weight-bearing x-rays because they tell us about 25% more, 20 to 25% more on the physics of how you bear your weight. And try all the natural things first, and if those don't work, trust me, your doctor of chiropractic is under obligation by the law to get you better and refer you out. And we will be the first ones to do that. With the remaining minute, I want to talk about one thing. Yeah, I've got 1 minute. Good, thanks. Sometimes there are congenital abnormalities in the spine where one bone slides on top of another one. And this happens for a number of different reasons, but if you look at the spine from the side, you'll see one bone that just slides forward on top of another one on the x-ray. We don't know why. Statistics haven't been able to tell us, but oftentimes these things also respond to conservative treatment. And the idea is to do the conservative thing first because you can't go back. So this program will be replayed on the bctv.org website. And if you have any questions, call your local doctor of chiropractic, or you can call us at 610-775-X-ray, and we'd be happy to talk to you. But remember, before you get your back operated on, see your local doctor of chiropractic. Good night.
Have you been injured on the job? Has your pain lasted for an extended period of time? Have you reported your injury to your company? Have you been examined by a company-authorized doctor? Did they say you were ready to go back to work while you were still in pain? You have certain rights, including visiting other doctors. In many cases, chiropractic care is more effective in relieving pain from back injuries. Call 610-775-X-ray today and let Shillington Chiropractic Associates put you on the road to recovery.